Believe me, for me as a doctor, this is type of treatment that all patients need to get. This is type of hospital that all hospitals supposed to be like this. And thank you so much for Cytecare Hospital. Thank you so much for all the team. Thank you so much for hard work. Thank you so much for the support that you give for the patient. My name is Mohammad Ali. I came from medical background. I studied medicine in China and I graduated 2019. My father was sick and he was diagnosed with a lot of disease. Most of them it wasn't like the real disease, which is he was diagnosed with IBS and another abdominal disease, but it was incorrect, all these diagnoses. But in the end I decided to go out of the country to get treated. So I asked my cousin, he's in India, I asked him to go and find for me any hospital. But before asking him, I did one test, which is all doctors in my country, they wasn't accepting. They said, it's no need for this test. It was CT scan, it's normal test for any patient you do. They didn't ask for it, but I asked for it because I came from medical background. So that time when I got the result and I saw that there is tumor in the pancreas, the head of the pancreas. So I decided to call my cousin just to go out of the country for treatment. Then my cousin told me there is one hospital close to me. Let me go check and then I will tell you. I said, all right. Then he came to Cytecare Hospital. That time when he told me there is one doctor, his name is Dr. Knes. He saw your report, he said, okay, we can bring him, no any issue. And it was so fast, so easy. We got all documents needed for flying out of the country. So just one day, it took from us one day in the embassy, even the embassy in my country, they was very cooperative. It took one day, got all the papers done, and the next day directly they fly out. When they came here, doctors see him, he ran few tests, then they said there is no need for any operation. But we will just manage it with painkillers and some other medication. That time I wasn't here. Next, like after 2-3 days, I came to India. When I came, I saw he's still suffering from the same pain that he was complaining about before. But I decided to just do another test, which is taking sample from the tumor. So we took the first sample. It was negative, there is no any cancer, there is no anything. Then we was happy, Dr. Knes said there is no need for operation. After that, we decided again to run the test one more time. When we ran it one more time, again the result came negative. There is no any disease, no any CA or anything. It was just kind of inflammation or necrosis of pancreas tissue. So from that time, then I just decided, let us go for surgery. Let us see surgeon and see what he will say. And even to see surgeon, it wasn't easy because the disease, it was very complicated. The disease, it was connected with few blood vessels like spleen, intestines, and hepatic vein. So it was kind of confusing. So it wasn't easy. We just went to another hospital, but we decided to just do the operation because even that time, Dr. Knes, he was willing to do the operation for us, but unfortunately he was on leave that time. He couldn't come because he was in the city. So we decided, because I see he's suffering so much pain, and what I know, if there is pain, if there is tumor, you can just take it out. Then after that, continue with other treatment. We took that operation, then after knowing out that there is CA in the head of the pancreas, directly we came from that hospital to this hospital, Cytecare Hospital. And we met Dr. Harish. It was really an honor for us to meet this doctor.
So I remember seeing Mr. Ali for the first time in our OPD when he was in severe pain and was not able to eat anything, and he had been to various hospitals where diagnosis could not be made, and he had met several doctors and several procedures were done, several biopsies were done, and they were not able to identify the disease. So what we did was, without a diagnosis of cancer, we were in any of the biopsies, looking at his CT scans, we were quite sure that we are dealing with cancer, even though none of the biopsies could identify any tumor. So explaining him about the nature of the disease and the difficulty in diagnosis, we proceeded to do major surgery without any diagnosis.
He make my father believe every single word that coming out of his mouth. Whatever Dr. Harish say, my father believe and just accept. Because like sometimes when you meet some doctors, like just from feeling, from your heart, you just like find yourself flowing out with them. Okay, so yeah, Dr. Harish saw his result, then he said directly he need to take chemotherapy. And we start our chemotherapy for 6 cycles. Then again we were supposed to go for radiation that time after 6 cycles. But Dr. Harish said our study that found out there is if you are gaining, or if you are like your disease is treated with chemo, it's more beneficial, so no need for you to take radiation. And we agree with him because his knowledge, his career, he's came through a lot, so I believe that he know what he's doing. So that time we just accept. He said let's go for another 12, for another 6 cycle. We accepted directly, we go for another 6. But before starting this 6, the first 6 cycle, my father was complaining of severe pain in the back. Dr. Harish told him just take the first cycle and the second, then we'll see. I believe this pain, I was thinking, and other doctors in another hospital, they were thinking this pain because his back pain, it's because of lumbar disc herniation. He was having past history of this disease. But Dr. Harish said this pain, it's radiated to the back, so it's part of the disease, part of the CA. So I accept. Then we took the cycle, the first cycle, the second one. Believe me, there is no any pain in his back after that cycle.
It was one of the difficult decisions to do, but then we spoke to the patient about this, and he also was okay with the decision, and so we did a surgery. And though we could not remove the tumor completely, more than 95% of the tumor was resected out, and immediately he showed very good relief from his pain. That was the basic idea of going and doing the surgery without a diagnosis. And also the surgery provided us with a diagnosis of a invasive tumor which was sitting in the pancreas and giving him a lot of pain. And post the surgery, we have given him a combination of 4 chemotherapies. Actually, it's quite a high dose chemotherapy which he tolerated the chemotherapy very well, did not have any major side effects, and his follow-up scans also showed a very good response.
Until today, he's very well. He's so good in, like, his body is tolerating good, and everything is fine. There is no pain, no anything. Just few things which is appetite, and it's manageable. Yeah, and really thanks all the hospital staffs from admission to all wards, like nursing, doctors, and international teams, and even the security. They are all cooperative, they are all good, friendly, and I appreciate every single thing that they have done for me. And believe me, for me as a doctor, this is type of treatment that all patients need to get. This is type of hospital that all hospitals supposed to be like this. And thank you so much for Cytecare Hospital. Thank you so much for all the team. Thank you so much for hard work. Thank you so much for the support that you give for the patient. And bye.
This would not have happened if we did not have a strong group of doctors, especially we discussed him in a tumor board, and with a strong suspicion, our surgeon felt that it is a tumor only and he has to undergo major surgery, and so we concluded that this had to be done, even though the multiple biopsies which was done before the surgery had returned negative for the cancer. So yeah, it was an amazing journey with the patient, and I hope he stays in remission for a long duration of time. Thanks.